All right, thank you very much for joining us today. We have some special announcements to make. I do want to make the residents of Tullahoma aware that there are some other people in the room with me today, but they are following CDC guidelines and sufficiently apart from each other. So first of all, a message to the people of Tullahoma. As mayor of Tullahoma, please understand my priorities are the health, safety, and well-being of the Tullahoma residents. Tullahoma, like much of the rest of the world, is experiencing extreme challenges. However, we are a strong, resilient, and giving community. I want to first make you aware of the steps you and your family need to take to be healthy. Follow the recommendations of healthcare experts like the CDC, your physician, and the county health department. There's a lot of false and misleading information on the internet. Please remain cautious and vigilant. As of Monday, March 23rd, there are no confirmed cases of the virus reported in Tullahoma. I have secured a listing of approximately 1,400 Tullahoma senior citizens over the age of 75. These are the citizens that are most vulnerable to this virus. Members of the Mayor's Youth Council are calling the seniors to see if they need errands run, such as picking up groceries, pet food, medicine, or paying a bill. If any senior is concerned about leaving their home, volunteers are in place who will gladly provide this service for you. If you or someone you know needs help with errands, please email me at mayor, M-A-Y-O-R, at tullahomatn.gov. Your city government is open and working hard for the residents of Tullahoma. Some city-run facilities and lobbies are closed, but all essential services are open and available. City Administrator Jennifer Moody will provide more details in just a few minutes. Finally, let's not think in terms of panic and fear, but envision the best of all possible outcomes. Let's all do our part and work together to get through this. Let's find creative ways we as a community can help one another. Now more than ever, people really need to love their neighbor, but please do so from a distance. We are in touch regularly with healthcare providers, the governor's office, and our local task force, and will continue to make information available. I realize this situation is an extreme challenge for everyone. We will get through this. As I said earlier, Tullahoma is a strong, resilient, and giving community. Now, the information that we're getting ready to provide is very fluid at this time. So we'll continue to make information available to you. So last week I announced that we would be hosting this question and answer session today, and I asked the residents of Tullahoma to submit questions. And as is often the case, the Tullahoma residents are not bashful, and I received many questions. So I'm going to read through the questions that were directed primarily to me, and then we'll call on others in the room to address questions that were directed to them. First of all, what responsibility and authority does the mayor have? That is found in section 20-605 of our Code of Ordinances. The mayor shall be responsible for meeting the problems and dangers to the city and its residents resulting from emergencies of any origin, and may issue proclamations and regulations concerning disaster relief and related matters which during an emergency situation shall have the full force and effect of law. If for any reason the mayor is not available, the line of authority and responsibility shall be the mayor pro tem, the city administrator, then the police chief. Each department head shall establish and include as part of the emergency operations plan a line of succession for his or her department. A state of emergency may be declared by the mayor by proclamation if he finds a disaster has occurred or that the threat thereof is imminent, and extraordinary measures are deemed necessary to cope with the existing or anticipated situation. Once declared, the state of emergency shall continue until terminated by proclamation of the city board. All proclamations issued pursuant to this section shall indicate the nature of the emergency in the area or areas affected by the proclamation, the conditions which required the proclamation of emergency, and the conditions under which it will be terminated. And then there list 12 examples of how the emergency can be proclaimed. Why are some restaurants still allowing people to eat inside? Well, yesterday, Governor Lee issued an executive order mandating alternative business models for restaurants and gyms. And this is Executive Order number 17, prohibits social gatherings of 10 or more people and enacts the following provisions regarding restaurants, bars, and similar food and drink establishments. Establishments are to exclusively offer drive-through, takeout, or delivery options to support families, businesses, and the food supply chain during this emergency. Establishments may sell alcohol by takeout or delivery with the purchase of food in closed containers to those who are age 21 and up. Gyms and fitness exercise centers are substantially similar facilities are to temporarily close and suspend in-person services until April 6, 2020. Why not shut down Tullahoma for 2 weeks? And we'll address that issue in just a moment. How do we volunteer to help those in need with errands? So a young lady here in town, Lee Fogel, has created a website and social media page to help share information for our community. www.wearetellahoma.com. On it, you will find links to federal, state, and local updates, as well as school links, healthcare updates, and other additional resources for businesses and the like. This site is being continuously updated, so please keep checking for updates. If information is missing or outdated, you can help us make it better by letting us know via a link at the bottom of the information page. In addition, the We Are Tullahoma website has a form for help request related to the shutdown, as well as a form for volunteers. Should you need help or want to volunteer in any way, from phone calls to pick up deliveries or even yard work, walking a dog, please go to the website to sign up. Our community is stronger together. By combining our volunteer efforts, we can manage resources best to help all those in need. Let's work together. Again, that website is www.wearetellahoma.com. So, too many young people are out at night. Can a curfew be established? Again, we will deal with that in just a moment. Mr. Mayor, what are you doing to keep our town safe? What about a shelter-in-place order? Again, we will address that issue in just a moment. How can we help our neighbors? Again, wearetellahoma.com. Will there be a tax increase to cover extra expenses and lost sales tax revenue? No. Is it safe to donate blood? I spoke with Blood Assurance this morning, and they are open. They're open from 8 o'clock to 5 o'clock Monday through Friday, and 8 to noon on Saturday and Sunday. They are taking the temperatures of individuals that wish to donate blood, and it is perfectly safe to give blood. What actions are being taken to prevent hoarding and price gouging? We have 5 major grocery stores in Tullahoma. I spoke with 4 of them this morning, spoke to the managers, and 3 of the 4 have senior-only times or senior-preferred times. They did see some initial hoarding initially, but that has calmed down significantly. Many of them have modified, many of the 4 indicated have modified their hours. They've all indicated they're doing extra cleaning, and all of them indicated to me that they have sufficient products in-house for essential products and services, and they do not anticipate any delay in getting additional products in. Why are some restaurants still open? Well, the governor's order yesterday, executive order, has dealt with that issue, and now, as he has said, they're only available for takeout and drive up and delivery. What is being done to support Tullahoma small businesses? So I would encourage the small businesses of Tullahoma to go to tullahomatn.gov, click on the COVID-19 resources link. There you will find helpful information about how businesses are adjusting their strategies during this situation. So I received this message from Pam Bussell at First Christian Church, and it's related to the Good Samaritan program. Yes, we are still giving food. While we are not officially open, we ask that anyone in Tullahoma needing food to please call 455-2200 and leave a message. We will return their call within 24 hours and make arrangements. So today I will sign an emergency proclamation, and I'm going to read that to you now. Whereas the virus disease 2019, COVID-19, is a respiratory disease caused by the SARS-CoV-2 virus that can result in mild or severe symptoms, including fever, cough, and shortness of breath, and can lead to serious illness or death, particularly in the case of older adults and persons with serious chronic medical conditions. And whereas COVID-19 is frequently spread through close contact between persons and respiratory transmission, and whereas on March 4th, 2020, the first case of COVID-19 in the state of Tennessee was identified, and several additional confirmed or presumptively positive cases of COVID-19 have since been identified in Tennessee, whereas the spread and identification of additional cases of COVID-19 in Tennessee is likely to continue, and therefore taking proactive steps to prevent a substantial risk to public health and safety is paramount. Whereas on March 12, 2020, pursuant to the authority granted by Tennessee Code Annotated, the Governor of Tennessee, Bill Lee, issued Executive Order Number 14, declaring a state of emergency. Whereas on March 13, 2020, the President of the United States declared a national state of emergency with respect to COVID-19. Whereas on March 17, 2020, the Mayor of Coffee County issued a proclamation of state of emergency with respect to COVID-19. And whereas both federal and state health officials have determined and advised that extraordinary and immediate measures must be taken to respond quickly to COVID-19, to prevent community spread, and to alleviate the suffering of people exposed to and those infected by the virus, as well as those that could potentially be infected or affected by COVID-19. And whereas it is necessary to restrict the activities of businesses and individuals in Tullahoma in order to protect the public health of the citizens of Tullahoma and Coffee County, to mitigate the impact of COVID-19, to bend the curve, and to disrupt the spread of the virus with the goal of saving lives and reducing strain on regional healthcare resources as much as possible. Now therefore, be it resolved that I, Lane Curlee, Mayor of the City of Tullahoma, Tennessee, by virtue of the authority vested in me, in light of the continuing emergency to facilitate the response to COVID-19, do hereby proclaim the following citywide. Number one, citizens of Tullahoma are strongly requested to shelter at home. When individuals must leave their home, they should practice social isolation, staying at least 6 feet apart, and should assume that others are infectious, regardless of whether they exhibit symptoms. Number two, a mandatory curfew order will go into effect at 12:01 on Monday, March 23rd, 2020. The curfew is effective between the hours of 9 p.m. and 6 a.m., during which all persons in the city of Tullahoma shall remain home. The curfew shall not apply to anyone performing emergency or first responder services, essential government services, law enforcement services, rescue services, safety services, health services, essential utility service, or military services. The curfew shall also not apply to anyone traveling to or from engaging in lawful employment. Number three, citizens of Tullahoma shall not participate in public or private events, meetings, or gatherings of more than 10 people. All such events or gatherings should be disconnected to the extent possible. Citizens of Tullahoma are encouraged to utilize all means of technology available and to avoid in-person contact. Number four, for offices, workplaces, and businesses that remain open, employees should work from home where feasible, and employees and their customers should observe precautions advised by the CDC to reduce the spread of COVID-19. Number 5, all businesses not performing essential services shall close their facilities to the public effective at 6 p.m. Tuesday, March 24th, 2020. Following are exemptions for essential services exempt from closure: federal and state offices and services and private companies or individuals performing under federal, state, or local government contracts, essential government functions including but not limited to law enforcement, public transportation, and businesses that provide government programs and services, companies providing media, communication, and telecommunication services, grocery and beverage stores, farmers markets, food banks, caterers, convenience stores selling food, agriculture, food manufacturing and processing, and other businesses that directly support the food supply, including but not limited to farming, livestock, and food cultivation, healthcare, mental and behavioral health, biomedical research, laboratory services, and other businesses that directly support the healthcare industry, but not limited to health information technology, staffing, and supplies, sanitation and waste removal, energy, water, and sewage businesses and services, pharmacies, medical supply, and other businesses that directly support the drug and medical supply pipeline, vehicle fuel support and service stations, vehicle parts and repair businesses, and vehicle sales, leasing, and rental businesses, banks, savings and loans, insurance companies, and accounting businesses, and other businesses that directly support the insurance and financial service sectors, real property marketing, leasing, purchase, and sale services, legal and judicial services, laundromats, laundry and cleaning services, home and business structure and equipment repair, hardware, building supply, and appliance sale and repairs, warehousing and storage facilities, construction, architectural, engineering, and surveying services, product logistics, transport and distribution businesses, parcel transportation and delivery businesses, veterinary and pet supply businesses and services, home and business cleaning and maintenance services, educational institutions, landscaping and nurseries, production, distribution, and sale of household consumer goods such as cleaning and personal care products, the educational institutions, public and private K-12 schools, private colleges and universities, trade schools, post-secondary and technical college, but only as needed to facilitate online or distance learning and essential functions, essential building maintenance and security, individuals whose job function requires them to be at their work location and who are essential to resolving the information systems, accounting, and human resource infrastructures of any business which is otherwise in substantial compliance with this order. Daycare and child care businesses shall remain open and should prioritize children of parents working for essential infrastructure sectors, businesses, or service providers to the extent practical. Nonprofit entities providing support and assistance in response to the COVID-19 pandemic. Other businesses and services that may be determined are essential for the continued safety and security of the city of Tullahoma. Number 6, essential services, especially grocery stores and pharmacies, shall make best efforts to establish hours of operations during which their services are available only to senior citizens or otherwise vulnerable populations. Essential services shall continue to adhere to CDC guidance on social distancing and hand hygiene in the workplace, including encouraging work from home and allowing employees, where possible, to work on-site in shifts to optimize social distances in the workplace where possible. Essential services are encouraged to utilize to the maximum extent possible any telecommuting or work from home procedures they can safely utilize. Any local ordinance, policy, or regulation inconsistent with this proclamation is hereby suspended. Then we've got the severability clause. Now therefore be it resolved that this proclamation shall be effective and enforceable at 12:01 on Monday, March 23rd, and shall remain in full force and effect until 12:01 on April 6, 2020, subject to extension as deemed necessary to protect the health and safety of citizens of Tullahoma. Now, I realize that is a long proclamation. I appreciate your indulgence, but we thought it was necessary to provide some direction as to particularly what businesses must close and which ones are able to stay open. So I'm going to summarize. Citizens of Tullahoma are strongly requested to shelter at home. A mandatory curfew order will go into effect at 12:01 tonight. Citizens of Tullahoma shall not participate in public or private events, meetings, or gatherings of more than 10 people. For offices, workplaces, and businesses that remain open, employees should work from home where feasible. All businesses not performing essential services shall close their facilities to the public effective 6 p.m. Tuesday, March 24th. And essential services, especially grocery stores and pharmacies, shall make best efforts to establish hours of operation during which their services are available only to senior citizens or otherwise vulnerable populations. Now, some might think this was a difficult decision for me to make, this emergency proclamation, but really it's not. As I said at the beginning of this program, my number one priority as mayor is the health, safety, and well-being of the residents of Tullahoma. Now, we have a number of panelists, or several panelists in the room with me now. I'll call on each of them in just a moment. I did ask our Tenova Healthcare Hoarding CEO, Rich Ellis, to attend. He's not able to attend, but he has addressed many of the questions that have come up from questions from residents. So these are questions and his answers. Can I go to my doctor to get tested? Yes. Per CDC guidelines, stay in touch with your doctor. Call ahead. If you have a medical appointment, call your doctor's office or emergency department and tell them you have or may have COVID-19. This will help the office protect themselves and other patients. Be sure to get care if you feel worse or you think it is an emergency. Per CDC, if you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. This list is not all-inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. What are the screening questions doctors' offices ask? Patients are being screened for known risk factors: fever, cough, and shortness of breath. Travel to areas with many identified cases or close contact with someone to be infected with COVID-19. Are there enough test kits in Tullahoma? Is there enough personal protection equipment for our medical professionals? How many are there and who has test kits in Tullahoma? Is it enough? What are the hospital's plans if there is a surge of patients? What are the hospital's plans for additional facilities, equipment, and financing? So here's his answer to those 5 questions. Our hospital is preparing to respond to the potential surge in patients, and we are reviewing our inventory, resources such as staffing and beds and protocols regularly as CDC guidance is revised. We're working in concert with the health department, and they have the best picture of what resources are available in the community and the region. Is the hospital having to postpone surgeries? At this time, we are limiting non-essential adult elective surgery and medical and surgical procedures, including all dental procedures. This will assist in the management of vital healthcare resources during this public health emergency, including supplies and protection of our medical team by limiting unnecessary, inadvertent exposure to COVID-19. Why is testing taking 7 days locally to receive results when other hospitals are getting results in potentially 3 days? Our clinicians are utilizing commercial labs to process any COVID-19 test. We cannot speak to what other providers are doing. What about virus patients who have special needs? How will they be treated if they test positive? Tenova Healthcare Hoarding will serve the needs of all of our patients, including any special needs patient who has tested positive for the virus, to the full extent of our capabilities. If the needs of the patient extend beyond what we can provide, we will facilitate transferring the patient to the most appropriate level of care. Are visitors allowed to Tenova Healthcare Hoarding? Our visitor limitations and restrictions are posted on our website, www.tenovahearton.com. These limitations are in place to protect patients, staff, and visitors and we ask for people to be supportive of these efforts. Now, as I said earlier, we have 6 people in the room I'm going to call on to address residents' questions and any additional insight they want to provide. So those are going to be Scott Hargrove, who is our interim director of schools. We'll call on him in just a moment. Debbie Dickey, who's the Coffee County Public Health Director. Darla Sane, the Coffee County Nursing Supervisor. Alan Lindley, who's the Coffee County Emergency Management Director. Our County Mayor, Gary Cordell, and then Jennifer Moody, City Administrator. So we'll start, first of all, with Mr. Hargrove, and then the Health Department, and then Mr. Lindley, Mr. Cordell, and then Ms. Moody, and then I'll conclude.
Thank you, Mayor Curlee. Our food nutrition team are currently serving breakfast and lunches to our students. All children under the age of 18 and under are being served. Angel Cardwell requested and gained a waiver from the state so we can continue to serve our students over spring break. You can find out the serving locations and the time on the Tullahoma City Schools Facebook page and Tullahoma City Public on Twitter. I'd like to thank Angela and her staff. Our Tullahoma City Schools Maintenance Department and building custodians have disinfected all of our buildings. Shout out to Tim Jensen and his team. Last week, Tennessee lawmakers requested the Education Commissioner, Penny Schwinn, ask for and Tennessee receive waivers for the following. There'll be no state testing this year as far as TN ready in our elementary and middle schools. There'll be no end of course test at Tullahoma High School. There'll be no state mandated civics test or 11th grade post-secondary readiness assessment at our high school. There'll be no mandated ACT testing for all our THS juniors. This waiver will only be in effect for the current school year. We are tentatively scheduled to start back to school on April 1st. This obviously is a fluid situation, as Mayor Curlee mentioned, and can change in a hurry. What does school look like if we are not in session on April 1st? We're going to provide an opportunity for our young learners to continue with their education. Many of our students have already been contacted by their teachers. Elementary schools will be providing learning bundles for their students. No devices, no electronic devices will be sent home. What exactly is a learning bundle? Maybe a passage from a book, projects, written assignments, directions for homework, worksheets, and a schedule for when the work should be completed. The first learning bundles sent out will focus on review materials only. We will produce learning bundles with new learning if the closure extends past a couple of weeks. March 30th and March 31st, our elementary schools will coordinate with parents and guardians on when and how the bundle delivery on April 1st will operate. Middle schools will provide digital learning bundles to students. East and West will also be conducting some virtual lessons. Hard copies of the learning will also be available. Their first learning bundle will also focus on review materials. And Tullahoma High School will mirror our middle school bundles, with the first bundles being available for pickup on April 1st. Again, our schools will be contacting our parents on how and when the learning bundles will be delivered, or how to gain access by April 1st, if we're not back in session by then. Our Tullahoma City Schools Technology Department will be providing guidance if your middle school or high school student doesn't have access to a device. So please check out your school's website or call the school. If the closure extends past the April 1st date, the goal of Tullahoma City Schools is to provide the opportunity for the best distance learning possible. We're set to grow a better learner We are set in growing a better learner for next fall for the 2020 and 2021 school year. And finally, there have been several individuals and groups in our community reach out and offer tutoring for our learners. We'll be coordinating with them in the upcoming weeks. Thank you to all those folks for stepping up in our community. And finally, we're always better together. Thank you.
Thank you, Mayor Curlee, for orchestrating this event for us to be able to share information with the public. First of all, I have with me Darla Sane. Darla Sane is the is the nursing supervisor for the Tullahoma Health Department, and she's hands-on, boots on the ground. So she's going to answer the majority of the medical type questions. I'm going to go through some of the ones that you had asked that were more community. First of all, one of the questions was, what was the role of the Tennessee Department of Health and the local health department in this? First of all, I want to say the situation is a rapidly changing situation. We get new guidance, new instructions on a daily, hourly, sometimes basis as this situation evolves. But overall, the Tennessee Department of Health is actually, they have powers and duties that by law to protect the public's health, safety, welfare, including situations such as this, which is investigating causes of diseases, especially epidemics. So that's the state office. And I can assure you that they are working diligently. Every Tennessee Department of Health employee, including the employees at the local level, are working diligently toward this COVID-19 situation. The local role of the health department is, Darla will cover that a lot in her presentation, but we also want you to know that while we're dealing with this situation, we're already working diligently to provide the services that we do on a daily basis to our patients. So that's part of what we're doing. And part of another thing is we're a source of community education and support for the local COVID-19. Okay, one of the questions we had is how will we know if someone in Tullahoma gets the virus? Well, there is a website. It's updated every day at 2 o'clock, and it goes county by county that gives the people in the individual counties that have been tested positive, and it is tn.gov/health. We'll supply all of these links for you, Mayor Curlee, so you can have those for your site. And then the next question is, what do we do if we suspect we have the virus? Well, first of all, we want you to call your PCP. If you're sick, call your PCP first. And if you don't have a PCP, you can call. There's 3 different numbers I can give you. One is for our South Central Health Operations Center, and it is 931-490-8312. It is manned from 8:30 to 4:30, Monday through Friday. So that was one that's newly established. Then there's 2 numbers through the central office in Nashville that you can call. They're 833-556-2476 and 877-857-2945. And these are available for people from 10 o'clock a.m. to 10 o'clock p.m. daily. One of the other questions was how can we stay healthy? One thing I wanted to share with you is if you go to the tn.gov website, there is a lot of information on there, and at the end of this thread of information, there's where you can click on and get posters, and this is what we're recommending. In addition to social distancing, which we've done in this room today, there's a poster that is entitled help keep illness from spreading. And these are actions that you should take daily to prevent any spread of any type of illness or respiratory virus like a cold or flu. Wash your hands often with soap and water for at least 20 seconds, especially after using the bathroom or blowing your nose, if that's not available, and before eating also. If that's not available, you use the hand sanitizer for that. If soap and water, cover your cough or sneeze into your elbow or tissue, dispose of the tissue. Don't touch your eyes or nose or mouth with unwashed hands. That's been difficult for a lot of people to do. Stay away from people who are sick. I mean, if you know there's someone that is sick, you don't want to go near those people. Stay at home when you're sick. That keeps you from spreading the virus. And clean and disinfect objects and surfaces regularly. Okay, I believe that is all of the questions I was to answer. Darla will have all the rest of those questions, and hopefully we're available at the health department if you'd like to call, and we'll help you and assist you, or we'll route you to the right people. Okay, Darla.
Thank you, Mayor Curlee. I wanted to address some of these questions that I will address were also touched on by Rich Ellis, but I'll just give you the viewpoint from the health department as well. The first one is, if someone in Tullahoma tests positive, where will they go? First off, many people that will test positive will have a mild case and can stay at home. They would just self-isolate, stay in touch with your doctor, stay away from others. So, and then if your symptoms, they grow and they get worse, such as shortness of breath, fevers going higher, contact your doctor. He also touched on, can I go to my doctor to be tested? It is recommended that you call your primary care physician first. If they are unable to, or they've run out of the testing or the sample, the specimen to get a sample, then you can contact maybe your urgent care facilities, or you can call your health department and we can find resources for you. Another one was, are there enough test kits in Tullahoma? First off, we're not testing in Tullahoma. We're collecting samples and sending to various laboratories for the testing. So there's some confusion with that. Sometimes they call the testing kits. Well, testing kits is what the main laboratories use. We use the sample collection kits. So, and this is ever evolving, and so having enough, one of the questions was, do you have enough? Having enough is hard to define, because that's ever changing depending on the need and as this thing grows. What is the role of the health department? I think Debbie touched on that a little bit. We're here for the community. We're a resource for you. So she provided you with the numbers and thought of websites that you can go to. If you do not know, or you forget, call us. We'd be glad to answer those questions or route you to a place where you can find that information. One of the questions was, will there be drive-through testing in Tullahoma? As far as the health department is concerned, we triage most of the people when they call in. We triage them and assess for symptoms, assess for their needs, whether they can be referred to their primary care physician, but if they're having some symptoms that we would recognize as being in the high risk, we would test them. We usually triage them from their car over the phone, and then we have what we call kind of a mini drive-through where they can come through to the back, and that's where we would gather the sample. And then another one that he had already touched on, why is testing taking 7 days locally to receive the results when Centennial Hospital is getting results in 3 days? For the health department standard, and we can only speak for like the state lab, and we realize there's other laboratories that are doing the testing as well. But from the state laboratory process, it's usually a turnaround of 48 hours on average. So that was the questions that I was addressing.
Thank you, Mayor Curlee, for inviting us. My name's Alan Lindley. I'm the Director of Emergency Management for Coffee County. On 3/19, Mayor Cordell declared an emergency for Coffee County. In that, it helped open up some funding streams. It also helped open up some resources that we could provide through our agency, and it opened up the coordination piece of our emergency operations plan. We have been planning for pandemics for several years. We have a pandemic plan working with the health department and our South Central region that we're continuously working through. I want to assure the citizens that our emergency operations center is up and running. We are practicing social distancing. So we're running that in a virtual mode for the most part. We have been in contact daily, sometimes hourly, with our partners, public safety, health, hospitals, and things like that, to provide, to provide the best service that we can to the citizens of the county as a whole. We are fielding calls almost by the minute on rumors and things, and I wanted to address the rumors. Please get your information from a trusted source. If it doesn't come from one of the government websites, the CDC, FEMA actually has put together a rumor control website to dispel a lot of rumors that have been coming down the line. In this, I think that Facebook, there's a lot of rumors that I'm seeing on Facebook and things like that, and Facebook is a really good platform to share information. We just have to be careful on the information that we share because we definitely don't want to create any more panic than what it's causing. So I encourage you, please follow trusted sources for information, and that will help curb a lot of the rumors that are flying, and we've had some good ones. If there's anything our office can do, you can reach out to us through the City of Tullahoma or through the county, and we will try to assist as best we can. Just know that we're looking at the big picture, and we've been working with the locals and the state and the feds on resources and how to best combat the COVID-19. Together, we'll get through it, and we'll be better on the other side. Thank you, Mayor.
Thank you, Lane, for this opportunity to stand in front of here today to address our citizens, and just got a few comments to share. As Mayor of Coffee County, I want to share a few thoughts with you. As Mayor Curlee is, and I am as others, we are very concerned for the citizens of our wonderful county, just as you are. I want to encourage you, we will get through this. We are Coffee Countyans, Tennessee volunteers. Call and ask you to do some things like calling and checking on your neighbors. Maybe fix a meal to share with someone. Check on our senior citizens. We must check on them. Maybe our children can take just a few minutes to lay down their cell phones and iPads and talk to their parents and grandparents. Maybe our families can sit down for a few minutes and share a meal together and say a blessing before your meal. History records that in World War II, the people of Great Britain were hunkered down out of fear of being bombed by the German planes. It's time for us as Coffee Countyans to hunker down. Maybe stay at home, practice social distancing, By doing so, you could save someone's life by staying home. All of our lives are being restricted. Plans are being put on hold. We can spend time changing our world. Stay strong for each other. Speak encouragement to a neighbor. I could go on and on. It's a challenging time in our county and our cities, a time like we've never encountered before. But we will get through this. I'm very concerned about our business owners and what they're experiencing. I'm deeply concerned about the child that may not have a meal to eat. Concerned for the single mom that is struggling from paycheck to paycheck, and the list goes on and on. I'm asking our churches to rise up, to band together as never before, to work together and to pray together, to pray that your needs will be met. Let faith rise up inside you. Do something to help ease the pain. I know our churches will probably not be meeting next Sunday, but I'm asking our churches and others to declare and set aside next Sunday as a Coffee County Day of prayer and fasting. Let us join together. May God bless Coffee County and God bless America. Thank you.
Okay, thank you. I'm Jennifer Moody. I'm the city administrator, and I wanted to share with you some of the necessary precautions that we are taking to keep your local government operating. We have many dedicated employees. I want to reassure you they are coming to work and our operations are continuing with only minor, I would say, limitations in that we have closed our walk-in services to the public. We've closed our public lobbies. This includes access to the recycling center, our Tullahoma Animal Shelter, our fire halls, and our city hall. But all of us are at work continuing to provide services. We are available via phone, email. Many of our services are online, so continue to use those, and we will help you in any way that we can. I appreciate everyone's patience as well, because we are fielding a lot of questions right now, and everyone that calls or emails, we will get back to you. I want to add that it's very important right now that as often as possible you are staying at home. The more that we shelter at home, the more that we can keep those who are sick isolated from everyone else. We can continue to protect our first responders, our police officers, our firefighters, our EMS professionals, and all of our other healthcare professionals from getting sick. We all want to come to work each day to serve you. So help us in that way if you can. I also want to share that the city has built a coronavirus resources page. It's on the city's website, which is Tullahoma, TN as in Tennessee, .gov. Right now, all of our public meetings are currently postponed. We are looking forward to being able next month to offer those in electronic format. We're still working through the details of how those electronic meetings will work. As much as we are able, we want to make those accessible to the public where you'll be able to interact live. So we are figuring out those details right now. I also want to share that many of you are aware this is the city's budget time, and we've received questions about the city's revenue sources, and are we concerned about having to make reductions in service right now? I just want to assure you we are looking at ways that we can limit our expenditures now, and the city has reserve accounts, rainy day funds, all of those things, as well as our policies to try to restrict spending so that we'll continue to operate without a tax increase or without any additional burden to the citizens. So I just wanted you to know that we are looking ahead and working on that. And then last, I would just share that just looking ahead, I know many people want to know how long do we think this is going to last? And I think none of us have a crystal ball, none of us have that answer, but I do want to say that I think we'll be in this, under this stay at home, keep public facilities closed for at least the next 4 to 8 weeks. And so we'll continue to operate and be available to you to answer your questions. And just call us if you need us. So thank you, Mayor. I think you can wrap this up for us.
So I want to take this opportunity to thank all the individuals that spoke today. I appreciate all of you and the work that you're doing on behalf of the people of Tullahoma. I also want to thank the volunteers. So many have stepped up to offer to volunteer to help their fellow citizens, and I appreciate that very much. I believe all the needs that I've been made aware of have been satisfied at this point. Should you have any questions or concerns that were not addressed today, if you'll email me at mayor, M-A-Y-O-R, @tullahomatn.gov, I'll do my very best to get back with you on a timely basis. I've received, as you can imagine, many emails. So as others have said, these are very challenging times. I understand that. I do respectfully request that individuals of Tullahoma honor the elements of the proclamation that I read a few minutes ago. I believe that will go a long ways towards keeping the virus down in Tullahoma. So thanks for viewing today, and hope you have a great day in Tullahoma. Thank you.